So once again, we're looking at patient-active approaches considering relational motion. The standard approach to the ankle, after we assess, find some bind, peak bind, okay? So contact is control and control is safety. If I hold here, what's going to end up happening is I'm going to have to work really hard with my arm. If I use my forearm, grab the heel, use my forearm and block, now I can get on bind, and it's way easier on me. I've got more contact, more control. Okay, so the standard method would be push your toes into my hand, let it go, and then I get some movement, right? So you can see that the overpressure, especially on release. What I can do is consider moving the rest of the body in relation to a relatively still foot and ankle. So what I want you to do is I want you to tip forwards, tip your body forwards, and let it go. Okay, that's quite powerful. The visibility of that to the camera is low. It's probably not going to show up well, but it worked quite a bit because you pushed everything, your whole body, forcefully. So we closed the joint a little bit. What I want you to do is turn your torso away from me. And that pushes in. That's pretty good, and it feels more comfortable. Okay, come back to the middle, and I don't let anything off of it. Twist your torso away from me, or towards me, sorry. And funny enough, that actually... So usually what that does is it pulls the leg away, but that actually built into your ankle and moved it a little bit. But of those, the thing that was the most appropriate was twisting your torso away because it was more comfortable and just as powerful as tipping forward. So as opposed to the previous example, when you look at the channel that we have of a similar movement, in this case, moving the entire torso essentially drives the leg into and out of the hold, which means it will work on the ankle joint, and the patient doesn't have to contract the area. Because when you contracted, it wasn't bad, but it didn't feel as comfortable as when you twisted your torso away, correct? Okay, sweet. Mikey likes it again. His name's not Mikey, it's Joel.